All right, well, I don't want to do any delays. We're going to have a little switch in our presenter today, but we are lucky and thrilled to have with us today Tammy Gendke, who is joining us from the Texas Education Agency. She is the AWARE State Coordinator and responsible for a lot of things around school mental health. I've been very lucky to work with her in a couple of different roles, and so I know we're in for a real treat today as we learn more about what TEA is doing around school mental health. All right, off to you, Tammy.
Okay. All right. Thank you. Can everybody hear me okay with this microphone setup? All right. Well, welcome and thank you so much for choosing this session and to learn more about school mental health and the things that are going on within the state as it relates to mental health. So I want to welcome everybody here in the room and also on camera. Today I want to introduce you to our mental wellness team. I will start with me. My name is Tammy Gendke, like Dr. Lopez said, and I'm the AWARE State Coordinator. If you don't know what AWARE is, you will in just a little bit, okay? We will go over that. So I will definitely let you know that. I have been with the agency since October. Prior to that, I was with Region 3 Education Service Center as their project manager for the grant. And so now I am able to continue that great work at the state level. So we have Julie Wayman. She is the director of the mental wellness team and an amazing resource. She has been with TEA for a really long time, and we are just blessed to be under her leadership. So we also have Ashton Millette. He is our AWARE Expansion Consortium. And if you don't know what the AWARE Expansion Consortium is, just wait, I'm going to tell you. So it's three of us that make up this wonderful team at TEA to do the amazing work of school mental health. All right, so the things that we're going to cover today, we're going to talk about what the AWARE grant is and give you a little overview so you can kind of have an understanding of what that is. I'm also going to go a little bit into what they call Title 4A. I'll explain what that is in just a minute. Going to talk to you about the why we're doing this. If you didn't know, we just got out of a legislative session. I know they've had a couple special sessions, but I want to go over the new legislation that has come from this last 88th legislation session. And then I'm going to share some mental health and wellness resources with you. Some of them come from Texas Education Agency, some come from other sources. So I do hope that you are able to leave here with a better understanding of why it's important to integrate school mental health into whatever organization, whether it be out of school, in school, that you happen to be associated with. And then also, I want you to leave here with additional resources that you can go out and use and share. And we're all here to help kids, right? All right, so let's jump into what Project AWARE is, and I'm talking to you about kind of where we started and then where we are right now. So has anybody in here ever heard of Project AWARE? All right, so a couple. Hey, that's pretty exciting. Well, we have developed these names to kind of keep up with the AWAREs now. We call the original AWARE, we tease and call it AWARE 1.0. And that's what I'm going to talk to you about right here. This is kind of the original grant that came to us. The Project AWARE grant is a federal grant that is funded by SAMHSA, so the Substance Use Mental Health Services Administration. And through that grant, TEA, the Texas Education Agency, along with partnerships with UT and HHSC, Health and Human Services Department, through that partnership, SAMHSA gave some money to be able to provide mental health services to certain districts that were highly impacted by Hurricane Harvey. Okay, so that's kind of, in case you're wondering, well, where did these districts come from? That's why. It was based on the impact of Hurricane Harvey. And so through that grant, it was a 5-year grant. Unfortunately, we're nearing that 5th year. September 30th is the end of that grant. But through Region 3, Region 5, we have 4 districts that are heavily involved within the grant. And through that, the goals are I'm going to tell you. The goals are to increase and improve access to culturally competent services, mental health services, and development appropriate. We want to increase the awareness and identification of mental health issues among the adults. So what we wanted to do, part of the goals was to go out and educate those that dealt with students. And not only teachers and staff, we've actually, through the grant, kind of broadened the horizons. We've had some districts that have trained their law enforcement, so their police, city police department, sheriff's departments. We've had districts that have gone out and trained clergy and those that work directly with students in some form or fashion in the community realm. So really try to work to get that mental health awareness out to adults. Another goal is we want to help students develop skills that promote resilience, self-regulation, pro-social behaviors, and we want to avoid, any sort of having the kids go to the level and degree of getting a mental health diagnosis, and we want to prevent violence also as we look at what we're doing in the goals. The fourth one, and this is kind of where we set, where we're kind of planted right now, is to develop an infrastructure that's going to sustain. Because I don't know if you've ever worked with a grant, and you may have a grant that comes in, you do great work, the money leaves, the grant ends, and everything falls apart. I love the fact that the goals of these grants are to come in and provide the money, set up the infrastructure, but as you're doing this with the goal in mind of what's going to happen when all that ends. So it's sustainability and see what can be sustained within the local education agencies. But also, we're looking at building statewide capacity. So as the districts are doing the great work that they're doing, as these education and service centers are doing the great work that they're doing, we are looking at the state level to see what may be gleaned from that and then shared throughout the state. So you're going to see some fruits of that here in this presentation. Some of the things that Project Aware did and implemented, through each school district, we were able to put a licensed mental health specialist in each district. So Region 5, the district that was a part of the grant is called Bridge City ISD. They're a little bit bigger district than the other districts, so they had 2 specialists within the district. So those Refugio ISD, Woodsboro ISD, Port Aransas ISD, those districts in Region 3 had 1 mental health specialist for each campus. And we've kind of learning at the end of the grant that human capacity that was added to those districts to provide mental health supports was just instrumental. Yes, ma'am?
You might not know this, but just for context, do you know if those schools are 4A, 3A, like as far as size-wise?
Okay. I can tell you, I can guess. I want to say, like, if you're looking at the schools in Region 3, they're probably 1A, 2A.
Okay, and that's Port Aransas.
Port Aransas, Woodsboro, and Refugio. For example, Port Aransas ISD doesn't have a football team. So in Texas, I was like, wow, that was a shocker to me. So they are very small. Now, when you go to Bridge City and ESD 5, they are a bigger school district. I'm going to say probably 4A, 4 or 5A. And so through the grant, what happened there is there was a feeder pattern that was chosen. So there was a elementary, intermediate, middle school, high school. So that feeder pattern. So that's a great question. So kind of give you an idea.
And the whole 4A, 3A, it relates back to football, right? That's how we know the size of the school district,
Exactly. Exactly. I will tell you, like Refugio ISD, for example, those online, you might want to Google it to make sure, but I think they have like 862 kids in their district. So pretty small.
Big area, it's not
Yeah, pretty small districts there for those 3. But then, like I said, Bridge City is a lot bigger. So it was great to see those 2 different perspectives in those grants. So more things that we did in the grant is really try to establish that positive behavior intervention and supports framework by introducing the interconnected system framework. And what that is it's bringing in those mental health supports into the school district. Because as we're going to talk about a little bit later, school districts can't meet every need of every student, right? That's just not how, it's not possible, it's not how they were set up. So we did, actually with the help of our amazing UT group, we were able to do school climate surveys, which produced some really great data for our districts. We did use the SHAPE assessment. So that's a national measure of different mental health supports within the districts, kind of see where you're at and maybe where you need to be. We did do a lot of training in evidence-based practices. So those mental health providers received a lot of training, the counselors on the school campus, administrators, everyone. So for example, as we're delivering suicide prevention, everyone from your custodians, cafeteria staff, the whole district was included, so no one was left out in that. We did do a comprehensive service delivery plan, and what that basically is just kind of a roadmap of where we're going to go, what we're going to do, the activities that were involved. We did a lot of awareness training. We also did screening for early identification of mental health and behavioral health issues. So if you know anything about screeners are just that one puzzle piece that fits into a whole big picture. Same as your reading screeners, your math screeners, those kind of things that are done on the school campus. We also built partnerships between school staff, community staff, and parents. So it was really great to watch that grow. All right, so I had to include this because I'm so proud of our team. This is just kind of a sample of the Region 3 and Region 5 team. There are some great things that they did. All right, so I like to think we did such an amazing job in the first AWARE grant that we were given the second AWARE grant that was awarded in 2021. So we call this the Expansion Consortium. And through that grant, it is actually taking care of 3 larger districts. So you have Elgin ISD, Manor ISD, and San Marcos ISD. And so those are all fall within the bounds of Region 13, which are going to be in this Austin area. So really exciting things are going to continue to happen with this. So this is another grant, like I said, was awarded to TEA, and these districts were chosen. So a part of this expansion consortium is to take the work that was started in the 1.0, as we like to call it, and bringing it further. So a lot more of the state supports and seeing what we can do on each individual levels to help. Part of the grant is to mold a partnership with the local mental health authorities. Okay, is anybody in here? Does anybody work at a local mental health authority? Elementary? Okay, yay! So part of that grant is to help bridge and bond the services and develop a partnership between those two, which is amazing. So we do have the state leadership team. As I said, Ashton Millette is our coordinator for that particular grant. All right, so another thing that we're doing at the state level, well, let me back up. So there is what we call the AWARE 3.0. SAMHSA came out and kind of did things a little bit differently. And so that grant was awarded to Laredo ISD, can get out, and through Region 1, and then also SCAN. It's called Students. There you go. Yes, they're serving children and adults in need. And so that grant has been awarded to them, and they are doing some phenomenally amazing things with that. So another AWARE grant was the opportunity presented itself to apply. And so I believe it was I think it was 12 entities within Texas applied for that. So we won't know if anyone got that until the end of August. So a lot of these AWARE grants are being put out, it seems to be, and so they're opening now where it's not only the state agency that can apply. So, all right, so another thing I wanted to mention just really briefly. So has anybody ever worked with their local education service center? Yay, oh, awesome, great. All right, so another opportunity that has presented itself is TEA does it's a mental health professional learning community, and it's through our PLC, and it's working with the state, the education service centers within the state. So there's 20 ESCs within that. What this particular program, our grant did was say, hey, ESCs, can you pick at least up to 5 small and rural schools that need help in the area of school mental health, and those ESCs then were able to coach and to work with those 5 districts, which has been amazing. And there's been many ESCs that have expanded it to help other small and rural districts. So through that, they have been able to provide districts coaching, training, those kind of things that help them do great things for kids. All right, so with this, over the last 3 years, the number of districts that have served, you can see, has grown. So from the year 2021 to the year 21-22, the number of districts that were served increased by 25%. Then it grew again 34% during this last year of 22-23. So this really exemplifies both the impact and the need of coaching from the ESCs to those small and rural school districts. Because we all know small and rural school districts don't have all of the resources and availability that the larger school districts may have. So one of the reasons that it's grown is because just the way the ESCs have approached their coaching with the districts have found it very valuable, seeking more, and then they were able to spread throughout. All right. So a little bit more highlights. We, through this grant, data comes in through the ESCs, and so we're able to compile that data to see how things are done. So through this grant, from March 22nd to February of 23, 550 total new resources were added. And I'm going to show you in a little bit where those resources were added to. If you haven't seen this resource, it's an amazing resource there. So one of the biggest impacts has been the increase of those resources. And also too, like 83 was the total number of campuses that conducted school climate surveys, which was really super cool. 82 of the districts did the SHAPE assessments that I talked about a little while ago that looked at your overall school mental health, and then you see the rest there. So there were a lot of topics covered as we met with the education service centers. And of those topics, you have, we have mental health needs, specific mental health needs. Maybe it was anxiety, depression, any mood disorders in general, all those kind of things. We talked about telehealth resources, talked about goal setting, behavior threat assessments, those kinds of things. And at the tier 2 level, you'll see that there was 201 trainings that centered around relationship-centered learning, restorative circles, parenting, at-risk students. And then here at the tier 1, we had 320 trainings that looked at your data collection, your needs assessment, where are you at, your SHAPE, resource mapping, all those kind of things that address the school as a whole. Is anyone familiar with the 3-tiered model? I know different agencies use it in different ways. Okay, so in education, we look at tier 1 being universal, so that's everyone. And then you have tier 2 where you're gonna have less, and then you have the tier 3 that is more individual and targeted. All right, so here's the why. As I mentioned before, school districts can't meet the needs of every child, right? And all children have different needs. So we have to look to see what's available, what's out there. How can we meet the needs? Because we do know, if you remember Maslow's hierarchy of needs, Maslow says that, hey, your basic needs need to be met before you can go on and learn and be self-actualized is the top part there. So as we look at teaching and we look at school environments, we do have to take into consideration this. And we're looking at the whole child and taking that approach from there. Okay. One of the things we also look at is trauma-informed practices. So I know there's a lot of training that's been available lately for trauma-informed practices, and we're really trying to bring that in as we look at our school mental health practices there. Because we want to reduce those risk factors that the students have, because our goal in education is for kids to learn, right? We want our students who are coming out of the education system to be, productive citizens that are making this world a better place. So we want to increase those protective factors. So those are factors that are going to help kids and prevent any type of serious mental illness, substance abuse, those kinds of things, okay? So our end goal is we want to make sure our kids are resilient, that they have, positive mental well-being and those things. All right, so this is kind of a graphic of how all things fit together. I don't know if any of you are familiar with Senate Bill 11. That came out during the 86th legislative session, so a couple years ago. And through that, we have really looked at how do things connect. And in the middle, you'll notice on this slide, the psychological and physical safety, because that is definitely a key focus in what we are doing. So as a part of those, you have your school mental health and behavioral health, you have your school safety and security, you have your targeted and aligned funding. So you have, want to have funding sources that are, are labeled for this and this only, and not being used for other things that aren't a focus of the district. And then academics and learning supports, definitely from there. All right. A goal too is to use data to help drive where we need to be as we look at the goals. All right. Another why, is anybody familiar with a youth behavior risk survey? Okay. If not, highly recommend looking at the data, kind of playing around with it, because it is huge. So what this is this is a survey that's given every 2 years, right, to different districts throughout the United States. And what this is, and it asks just different questions. What this particular graph is looking at how things are after COVID. So, and we all know, if you've looked at statistics or read any articles, you notice that mental health really came to the forefront during COVID, right? That was a big factor and big piece there. So here, this just shows that the persistent feelings of sadness or hopelessness during, this was 2021, this is the latest data, at least that I have access to. And so you see how there's an increase of kids who have that just ongoing, they just feel sad. And then you also see here how you have those that have seriously considered attempting suicide. And so unfortunately, we still have an increase there. So that's why it's so important to consider those. So whatever organization you work with, whatever job you work with, if you're working with kids, mental health, it definitely needs to be the forefront on the conversations there. All right, so here is just another chart just showing the impact of student mental health needs during COVID-19. And this next slide talks about nearly 1 in 3 parents shared that their children's emotional health is worse than it was before the pandemic. So I don't know, I'm sure each one of us has stories of, hearing about someone that really struggled during that pandemic with their mental health needs during that time. So it's really crucial, again, that we have that as a focus. This is data that we gleaned from the AWARE grants, and I just wanted to share this with you. These are the reasons why students were referred to the mental health specialist. And can you see which number one? Okay, anxiety. For those students that you work with, do you feel like that's kind of on par, maybe the number one issue that you're seeing? Just to note, where it says other, these are other categories, like maybe like peer issues, being bullied, attendance issues, difficulty adjusting to life changes, those kinds of things.
Is the fear of being in with shootings and things? Does that just fall under anxiety?
In this, oh, okay, yeah, so, no, you're good. So the question was the fear of being at school due to school shootings, was that a part of anxiety? So didn't ask that specific question, it's just as a whole, but could be. I think fear would go there.
So, all these things listed, is this based just on like the wording of how they reported that out? Or does it have anything to do with the DSM-5?
Oh, good question.
Like ADHD, I don't see autism, I don't
Yes.
see DMDD, and I mean, those are the majority of the things that we're seeing when
Yeah.
kids come through, or some of those top diagnosis versus, I mean, and anxiety is in there as well, but usually it's ADHD, DMDD, autism, maybe some depression, and then anxiety,
Okay,
or some psychotic symptoms in there as well, but I don't see that
okay.
in there.
Well, then that's a great question. So the question is does this reflect any DSM-5 diagnostic criteria? And so the answer is no. This was based on the referral question as far as how they got to the licensed mental health specialist. So in our particular grant, each thing was done a little bit different. And so usually weren't looking at the diagnostic criteria. They were focused more on the symptoms to help and alleviate that. But that's a really, really good question. And I appreciate you asking that. So this is more based on, again, the referral, the reason why the students were referred. All right, so just a few more statistics. 20% of youth ages 13 through 18 live with a mental health condition, all right? So again, the importance of having some sort of school mental health services so that these students, because we know early intervention is key, right? For anything, yeah, because you mentioned autism, and we're learning that there's a lot of great things that happen when students have that early intervention. Sadly, it is an average length about 8 to 10 years between when the student or when the child is starting displaying symptoms until the time they actually get help. That's a huge span of time there. And then approximately 50% of students age 14 and older with a mental illness drop out of high school. So that is a really sad statistic, because as you know, education is very important to just our functioning in life. And so it's very sad to see that particular statistic. As we know, this is just a review of some of the warning signs that we look for whenever students are maybe beginning to experience some sort of a mental health challenge. You see these warning signs up there. You have anywhere from feeling sad or withdrawn, and it's for more than 2 weeks, because when you work with students in school, especially when you get to the junior high and high school age, you have those breakups where they are so sad and just devastating for a couple days, but then they're able to move on. This is looking, that's more developmentally appropriate. This is looking for things that go outside of the realm of that developmental appropriateness. All right, so wanted to add this slide because I know that some of the audience members and those online may be parents. So wanted to give 4 suggestions of what parents can do if they notice any of those previous warning signs in their children. Of course, first and foremost, you can always talk with your pediatrician to ask to see, because they're going to be an expert on as far as what is developmentally appropriate, what may need additional interventions. May need to get a referral to a mental health specialist. And I know right now, not only in Texas, but nationwide, I know that we have a shortage of mental health providers, whether it be, child psychiatrists, licensed professional counselors, the whole span. There is a shortage. So I do know that sometimes it is difficult to be able to get a referral to a mental health specialist. But I'm going to show you some resources that may help if you're not familiar with them. Also work with the school, because there are a lot of school districts that offer additional services that parents may not be aware of, or maybe community members may not be aware of, or other agencies. So talk with the school. They may have other options that aren't available, outside. And then connect with other families, right? Because that peer support is great among kids, and it's even amazing, or I know it's not a word, for parents to be able to have that peer support within parents, to connect with those parents that maybe have already navigated through the system, and they know exactly kind of how to handle things and what to do. So having that network is huge. All right, so I wanted to do a little turn and talk, or on, if you're on Zoom, feel free to put in the chat box, but I wanted you to kind of talk about, and we're only gonna take 2 minutes to do this, but talk about what challenges do children face today that you feel that they face today. How have things changed in the last few years? Because I know everyone in here, your field of work is different. And some of us, in here may be parents also. So talk about how things might have changed in the last 5 years within your field. And then what's your biggest challenge in working with students today? And then what is your go-to resource for help or referrals, okay? So let's just take 2 minutes. And so for those of you online, feel free to just blow up the chat with different things on these questions. Huh? Y'all are just going to have the conversation, and I'm really going to only ask you about the resources. So I just want y'all to kind of get a chance to talk about it. And answering these questions. But let's finish your thought, and then let's come on back. All right, so hopefully my goal of asking these questions, my goal of asking these questions was to spark conversation, right? Right? Because I know we're all in here, we're all passionate, right, about helping kids and making sure that they become successful adults. So that was the goal. I really wanted y'all to start those conversations and really think about what the challenges are for our students today. Because even if you're a young parent, the things that were out there in this world are totally different than what our children experience now. I have a 21-year-old and I have a 16-year-old. So technically they're still in the same generation, right? Well, their experiences are totally different, totally different. And so even just a small age range makes a big difference. So we do have a lot more challenges than what we have experience with when we were kids. So just something to keep in mind there. So the question I do want to kind of ask to the room, and again online, feel free to put it in the chat box, but what is your go-to resource or referral. So when kids are having challenges and things of that nature, you don't have to give me specific organizations or anything like that, but do you have like a go-to resource where, yes, I refer to our local mental health authority, or yes, we have a substance use program that's in our area, or maybe it's, hey, I use that 211 website. Kind of throw out, what kind of resources do y'all use, your go-to?
Our mental health authority covers about 6 counties, and for our rural counties, they hired a care coordinator that's specific to our county, and she's very involved in our CRCG, and I give her name and phone number out to everybody, and she not just focuses on the services of the mental health authority, but any kind of agency that works with kids, whether it's housing or food or whatever the needs a family might have, and she's been wonderful. So highly recommend those care coordinators for the LMHA.
What a blessing. That is awesome. That is a great resource. Does anybody else have any kind of go-to resource or? Oh, there's 2 hands.
I would use our certified family partner or our Yes Waiver program.
Excellent. Awesome. Thank you. So the family partner, certified family partner, or the Yes Waiver program?
I would usually use our university counseling team. We also have a Boys and Girls Club on campus, as well as I don't know, but they're there.
Awesome. Hey, that's great. And that's why I love hearing these different resources. So we have 2 up here, Dr. Lopez. Get her steps in.
Hi, we've been using a lot Charlie's Health. It's completely virtual, and that seems to be working out very well for our families.
Okay.
They do the counseling group, even activities such as yoga, crafting, and it's all virtual.
Oh, wow. Charlie's Health. Okay. All right.
If I'm working, I am a certified family partner, and so if I am working with a family who has a child with behavioral health difficulties, and they haven't been identified for special education, and they might benefit from specially designed instruction, I would prefer that they be evaluated through the FIE process.
Okay. Awesome. And that's great to have that resource and that knowledge for parents.
Hi, I am from Tarrant County, but we just implemented in Fort Worth ISD this last year. We have school navigators, so My Health, My Resources of Tarrant County funds those providers. They actually work for the school district, and they help connect the families and students to services with our organization.
That's awesome. Thank you for sharing that. And I appreciate y'all sharing those resources, because I love hearing the different things, because I know so many times we hear that we have a lack of resources, or there's nowhere to send families to help. But it's good to know that there are resources out there, and different counties and different areas are doing different things, and they're getting creative with what they do. So that's very, very exciting to hear. What we're going to do next is if this works, what we're going to do next is we are going to jump in to the legislative updates. I know we're kind of into the why, but there's a lot to cover that we really wanted you to know about. So through this 88th legislative cycle, there was a whole lot of bills. I was so excited because mental health was on the forefront, right? Mental health was on the tips of a lot of people's tongues. And that was pretty phenomenal there. Unfortunately, there were, some bills that didn't pass that were related to mental health, but at least people were having the conversations around it. So I'm going to talk to you today, and for those taking pictures, I'm going to advance the slide here because there's more. So this is just a summary of those bills. There were 10 that I'm going to kind of highlight and go through quickly there. So if you want to catch a picture of that, those are the bills with a little bit of summary. The first one I want to talk about is House Bill 728. And this one has to do with the firearm background checks and who can be issued a permit to own a firearm. So they changed things up. And they amended the health and safety code to say that basically if someone's 16 years and older has a court order or has gone through court, they are not allowed to. They get on the prohibited persons list as far as who can own a firearm. So here, the court says when the court orders a person to receive inpatient mental health services, the court acquits a person in a criminal case by reason of insanity or lack of mental responsibility. When the court commits a person determined to have an intellectual disability for long-term placement in a residential care facility, or if the court determines a person's unfit to stand trial, or if the court finds a person entitled to relief from some disabilities. There's others. I recommend, if you're really interested in that, to go ahead and pull that one up and read that through. So that's one. House Bill 3186. This is one that creates.
I'm sorry, I had a question
Sure.
on the previous slide.
Sure.
So, and maybe my glasses just aren't working for me.
Huh?
But are you saying if the person has any of those things that is checked below, they can't get a firearm?
It's if the court determines.
But if a court determines any of those things,
Yes,
then they can't get a firearm.
correct. That is my interpretation of that.
Do you know how long that's in effect? Like, is this a lifetime thing if they've ever been determined to have one of those things?
Oh, like a look back. Is there a look back period? I don't know that answer. That's a really good question to look at. Okay, so they would need to go back to court. Okay, thank you for that, because that is a really good question. I had not thought about a look back period.
No, I have another comment.
Sure.
I'm gonna keep it to myself.
I figured this one might have a little debate, so yes, we are on video, right?
That was to myself.
All right. So House Bill 3186 creates a youth diversion program called the Texas Youth Diversion and Early Intervention Act. So this one adds comprehensive youth diversion strategies and procedures for children accused of certain fine-only misdemeanors other than traffic violations. And so this goes through, and this just kind of gives a summary of that youth diversion plan. So it does say each justice and municipal court shall adopt. It doesn't say, so justice and municipal court. Sorry, I was going on a different route. So government entities may develop collaboration with municipal, county, or regional youth diversion plans, and it kind of goes in here. So what you're kind of wondering, what does that have to do with TEA? But here it talks about youth diversion plans may include an agreement with the service providers, including schools, to provide services for those diversion strategies. So which is huge, because now you can form a partnership between the schools and these courts in order to help those kids that have received those fine-only misdemeanors. So this is kind of a to be continued. I'm really anxious to see how this one rolls out, to see if they provide case managers that can work with the schools, those kinds of things. So we'll see how this one rolls out from there. So Senate Bill 26. This is one that I don't know if you're familiar with the non-physician mental health provider. What I think it was 86 legislation. Don't quote me on that. But in the past, legislators set up this position, I guess you could say, for the non-physician mental health provider. So these are licensed mental health professionals who can practice independently. And from there, they're actually employed with the local mental health authority, but they provide services within the educational service centers. So again, an amazing partnership, right? And so through that, what has been discovered is there are a lot of education service centers and local mental health authorities that don't have these positions. Why? Because kind of what I talked about before is there's such a shortage. So what they did this time is they said that they added a licensed master social worker and a licensed professional counselor associate. So what that means is they're not a fully licensed LPC yet. So they added those two career paths to those who could be hired as a non-physician mental health provider, hoping to open up, the career paths to have those so they can be fulfilled and do great things. Yes, ma'am.
And it was actually a question that we had on the last slide about the collaboration with the municipal courts. Was there any funding given to help develop this collaboration in regards to these juvenile case managers within the court systems in order to have that collaboration with the municipal courts?
I honestly, and I apologize, I can't answer that question directly. I know that they can seek funding, and I know that if you read the bill, I think they address it a little bit more. But I apologize, do not have that set to memory on the actual funding.
Okay. We were just wondering, because I know a lot of times the legislature,
yes, those
spews some
unfunded mandates
things out, but they don't put any dollars behind it.
Yes.
And I'm just wondering how counties are supposed to implement it if there's no funding.
Yeah, so I would definitely go back and look at House Bill 3186 because we looked at a lot of bills. So I apologize, I don't remember that exact.
We'll look at the bill.
Yes, look at the bill. That's awesome. All right, and so anyway, so this kind of broadens the jobs, their career paths, the licenses that can be used for that. All right, House Bill 2059. Is providing mental health first aid training. Does anybody in here, are you a trainer of mental health first aid? Okay, all right. So what this does is this allows local mental health authorities to be able, let me back up. Local mental health authorities now can be reimbursed for providing the youth mental health first aid training to schools. Now what they have done is they've kind of opened up the reimbursement so that the local mental health authorities can train for more. So charter schools, universities, those are child care facilities. I love this. Individuals with direct and recurring contact with students. It's pretty open, right? Contractors of public and private schools, other people specified, including first responders, military veterans, family members of military members, veterans, judges, attorneys,
juvenile probation officer.
kind of opening up the gamut of who they can provide that training to and then get the reimbursement for that. So, all right, then we go into House Bill 1, and of course this is Rider 85, but it talks about the fentanyl contamination training. So this this makes or has the amount here that it's appropriation for $2.6 million in funds from the opioid abatement account to provide training developed by UT Health Science Center in San Antonio. They're going to use Education Service Center staff to train school district employees on the dangers of fentanyl contamination. Where did I get that? So this is one which is great because getting the word out there with the fentanyl use and stuff is major. So they are going to provide funds to be able to use education service centers to do that. House Bill 473, parent engagement and a behavior threat assessment. So kind of to back up, to give a little history of the behavior threat assessments, this is a process that the school districts go through when they have a student who may, be a threat to themselves or others. And so what this particular piece of legislation does is it says, hey, the parents need to know about it. They need to be invited, whether in person or remote. And they need to have the opportunity to provide information for the students. And then the behavior threat assessment team has to communicate the findings from that threat assessment to the parents. So again, it's just having that parent voice within that group. All right, House Bill 2100. So this is adding some more licensures to a loan repayment program in the hopes that maybe we can get more mental health professionals out there. And one of the stipulations is that mental health provider, must provide services for those that are eligible for Medicaid. All right. Senate Bill 763 is school chaplains. School chaplains are now available to be employed through the school districts, and I'll let you read that and do further research on that. All right, Senate Bill 798 is in regards to school counselors. And let me back up. Speaking of, that's what I forgot to say. So this is, with a school chaplain, is to provide support services and programs for students as assigned by the Board of Trustees in their school district. And, okay. Sorry, I was going to read that to you and I forgot. So this is a school counselor. So when you become a school counselor, you have a master's degree in your school counseling, but there's also has been used to be 3-year requirement that you have to be a teacher. Then it went down to 2-year requirement that you have to be a teacher. And so what they did is they removed that, because kind of like mental health professionals, school counselors are very hard to find. And so what the legislators did is to remove that in the hopes that I guess they must have identified that as a barrier. And so they removed that requirement for that. So we will see the State Board of Educator, their SBEC, but the State Board of Educator certification is supposed to put out rules by January of 2024. So we'll see what comes about that there. Let's see. Okay, so House Bill 3 is like 30 pages, but this is just a little section of it. And it requires a district employee who regularly interacts with students to complete an evidence-based mental health training program. So it doesn't outline a specific program, it just gives an overview.
Would that be mental health first aid?
It's not specific, but it could be, yes. And so with this, SBEC, the educator certification, they are looking at rules so that educators can receive credit that goes towards their continuing education hours there, okay? So the commissioner will adopt rules related to travel and training reimbursement. Of course, these are all hot off the press. All that is being, worked on and in the process. So, but that does allow and give access to additional training, and then it allows the districts to be reimbursed. Yes. Oh, right here.
I just feel like it's worth pointing out that this is also, sorry, I started talking. This is worth pointing out, this is also the bill that requires them to have an armed person on campus at all times too. And I love that they're talking about their mental health training, but I also would like to see studies, and I know this has nothing to do, this is me on my soapbox, to do some kind of study of how that affects a child's mental health, to have someone with a gun walking around. And is it the person with the gun that's doing the mental health training? I didn't think so. I can go on forever. So
Okay. So yes, House Bill 3 is 30 pages. So, feel free definitely to look that up and read all the additional requirements there. Another part of House Bill 3 is the school safety allotment. So with that school safety allotment, it allows for $10 for each student who the ADA, or average daily attendance, and then it kind of goes from there.
It's $15,000 to put the entire bill into place for each campus?
It's $15,000 per campus. So that's what they get in addition to the $10 for the attendance. So that's how it works there. So depending on how many campuses your district depending on how many campuses your district has is how much money they get. So a little note here, it says increases ongoing school safety funding by $300 million per biennium. So that's about $150 million per year through that. So for further information, I would look at House Bill 3. All right, so some other mental health legislative actions that took place during the session was the first Children's Mental Health Strategic Plan. Of course, this is all new, so it hasn't been developed yet, but they do have that as a task. Funding appropriated to the Health and Human Services Commission for various or new expanded mental health initiatives. So purchasing more psychiatric beds, let's see, with their MCOTs, their mobile crisis outreach teams. It kind of goes through there. There's a new behavioral health facility for Uvalde. They also added kind of the extension of TCHAT. So they gave them more money for TCHAT. If you're not familiar with TCHAT, I'm going to talk about it in just a little bit. So, and then there's also additional funding and things of that nature for your mental health workforce programs, right? So it's looking at, again, addressing the lack of mental health care available. I'm gonna give up on that one. Okay, so for the last few little bits that we have together, I want to kind of go through these mental health resources with you, and I would love to just hear, or you could even just raise your hand if you already know about these. Yes, ma'am. Sure.
So I appreciate the state's commitment to evidence-based practices, and so as we all know, research shows that youth, LGBTQIA+ youth, more likely to experience homelessness, die by suicide, experience depression. And I'm curious, I don't see a whole lot, and I understand why I don't see that up here, but I am curious how schools are expected to respond when they're not able to even state that this is a safe space. And is it truly a safe space in the schools for kids in that population? I'm just curious how the schools are expected to respond.
And I wish I had an answer for you. I can't answer that because there's such a, there's a huge education system, and I'm just part of one. But as we look at mental health care, we've got to look at mental health for all students, right? To address that. So
does that mean like in a school with a social worker would a social worker or a teacher or school counselor in a school setting be able to provide resources to a kiddo that's talking about that? Or do you know?
Usually it's a district decision. Those kind of things are discussed amongst the district teams and things of that nature. So I kind of would get with your local education agency, your district, to ask those specific questions, because each one is always different. So, and it goes to the local control and those kinds of things. So.
But equity and inclusion are not words that are allowed, correct? Because I know there was a training that we were doing in partnership with our local service center, and those words appeared in the title, and so they had to pull out because the state does not allow its agencies to use those words, correct?
I can't answer that question. I'm sorry, I don't know. I don't know. That may be a question for someone in a different position, but I apologize.
This is all in reference to mental health, though, correct?
Yeah.
I mean, that's just, I guess, why they're coming up for us.
Gotcha. No, I understand, and I know it's a struggle, but and I apologize for not being able to give you an answer.
I actually have a question too.
Sure.
Piggybacking off of the equity and the equity and inclusion, I have a question about school chaplains as well, mainly because a lot of people associate so I'm from Killeen, and we have a really big military family, and I agree with you, LGBTQ+ students are not really welcome in the school that I used to teach at. And so a lot of parents are also Christian, and they welcome school chaplains. But at the same time, though, how is that, especially with counselors and teachers who have had to go with extra training for mental health, sometimes even more so, bringing in like with chaplains and with religious backgrounds and stuff like that, mainly that are predominantly Christian, how would that, how would that encourage students to, especially those who don't identify as the predominant religion or anything like that?
Well, and I know that because I know that question's being asked throughout the state. My advice, because it does come from the legislatures, so to probably get those specific answers would be to contact those legislatures. So as TEA, we are, things are done outside of, and so we have to execute what the legislation says. So I know it's a widely debated topic, and those questions have been answered. So I highly recommend, maybe looking at that. Okay, so for time's sake, let me go through the mental health resources because these are tools that you can put in your pocket, and I apologize for my limited answers to those questions, but. TEA has developed the Texas Mental Health School Framework. I love this graphic that really looks at the different elements of school mental health. So what we look at is, and I'm not going to go through this whole slide here, but looking anywhere from teaming and planning all the way up to your positive, safe, and supportive school climates. So MTSS for mental health, what that is, that's multi-tiered systems of support for mental health, and looking at the different components of that. So often, the multi-tiered systems of support were only for academics, right? So we realize and we understand the importance of student mental health and bringing those in to marry those systems so that we can look at and address the whole child. Right? Okay, here is just a sample of what is looked at through that multi-tiered systems of support. Say that fast 5 times. And starting here at tier 1, family, school, and community partnerships are huge, right? Because who is the expert of the student? The parents, right? Their family. So bringing those in as a collaboration and partnership is huge for student success. Looking at different policies, protocols, what professional development is given to the teachers, those are crucial, again, for that safe, supported school environment. Looking at kind of universal approaches that promote and build positive social, emotion, and behavioral skills, bringing that trauma-informed practices in to that will, again, help that school climate and the overall student wellness. Then you get into the tier 2, where you're looking at the targeted supports and early interventions for students. And then you're jumping to the tier 3, which is more of those individual intensive services. So here is a pathway to the quality mental health services. Again, looking anywhere from teaming, you're really collecting your data, you're getting the word out there because let's face it, there's a lot of stigma against mental health, right? Would you all agree to that? So getting it out, that same as it's okay to go to the doctor when you have a hurt toe, it's okay to seek other treatment when you have emotional hurts. Early intervention and access to specialized services, of course, funding and sustainability of programs. And then you want to monitor those programs, right? Are they really effective? Are we really, are these programs effective to where it's worth putting our funding into those? Okay, so with all of that, there's a Texas School Mental Health website. So raise your hand, and online too, raise your hand if you happen to know what this website is or have seen it. Okay, so not a lot of people, so I'm excited for those that have seen it, even more excited for those that haven't seen it, because today you get to see it. So within this website, there's a lot of different amazing materials and resources in this particular toolkit. So here, this is just kind of a sample. I just took a screenshot and put on what's there. There's a lot of resources that came out of the AWARE grant as we walk through that process. And so there's, there's resources in Spanish too. There's for suicide prevention. screening, school climate, for community-based resources. So for those, there's actually like a sample memorandum of understanding. If you're developing a partnership with someone, that could be utilized. So I will highly recommend checking that one out there. Molly, what's the end time?
Sorry.
Oh, no, that's okay.
11:45.
Okay, all right, awesome. So here, through Senate Bill 11, what Senate Bill 11 tasks us with is to have TEA develop a rubric that the Education Service Centers use in identifying these resources, right? Because there's so many resources out there, and sometimes we as a school district or outside agencies may not know what those resources are. For about 9 years, I was blessed to be the chair for a CRCG, or Community Resource Coordination Group. And it amazed me how many resources that we didn't know that was available in the area. And so we made sure to bring those and have them a seat at the table. So what this does is it requires the agency to share the rubric with the ESCs every December of odd number of years, and then it requires ESCs to submit a report to TEA with these different resources there. All right, so some of the resources could be training and technical assistance, school-based programs like Community in Schools. Is anybody from Community in Schools or work with Community in Schools? Okay, yay, okay, all right, amazing program. And community-based programs, so that could be a plethora of different programs, school-based mental health providers, and your public and private funding sources, right? So those kind of things that are looked at there. This is a sample of what the school mental health resources page looks like. There is a QR code, so if you want to, hopefully it works with your phone, to bring that up so you can kind of play with it and see. They are in the stages of kind of revising things, because you put out things, you realize there's bugs or glitches or needs improvement, and so they are working on doing that. You can search for whatever you need. It does include 1,367 unique mental health resources. And anyway, great. It's a really great thing here. The next part of this is, let's skip that slide. Okay, so I don't know if any of you were able to attend or knew anything about it, but we did host a mental and behavioral health webinar series. And so these that are on the screen are examples of what we did. We actually did another one in June. You can go to the website and look under webinars. This page will pop up. Those webinars were recorded, and any material that the presenter provided is available to you there. So highly, highly recommend watching those and looking through that. So you see right here, this third one talked all about the mental health resource database. So you can go through and look through that. If you want to know more about TChat, we had a TChat representative come and speak. The great thing about this too is because we did have districts and people kind of, boots on the ground, if you will, come and talk about different parts of their program and things of that nature. So highly recommend you look at that. All right, for time's sake, I'm gonna skip that. I do want you, and for time's sake, where am I at? All right, so we'll probably just take a little bit, but feel free to do this while I'm talking. I did want you to kind of play with this to get an idea so that you see it, what a great resource it is. And so my challenge to you was, like, for example, think about your county of residence or the county you work in, whatever county you want. Look up and see, can you find your local mental health authority? Did it pop up on that screen? One of the other things we won't get into today, but did you find your education service center? And then is your organization listed on the database? If your organization, if you feel like it needs to be listed and it's not, you can contact your education service center and let them know that, hey, we are a resource that may benefit being on there, okay? So I'm going to take just, for time's sake, I'm just going to take like 1 minute. Just want to get y'all to really get in there and kind of play with things. Okay. Want to leave time for questions? Okay, let's take another about 10 seconds. And feel free to keep looking as I continue to talk. All right, so here on that same website, that website is just full of amazing information, there's a best practice list. So in this best practice list, you can look up some evidence-based, I was gonna say curriculum, could be anything. But like, for example, here is, like, I'm gonna take ripple effects for an example. I used to use that when I was at the district. You can click on that card and it's gonna give you all of the information that you may need for that particular program. So this helps, like, as we're developing programs and you're like, hey, I need an evidence-based materials. This allows you to go and kind of, now this is not an exhaustive list. This is kind of a, it continues to grow, all right? So if you're looking for something in particular, it's not on there, it may be coming. You can filter by component or by resource type. This best practice list was a collaboration between TEA, Health and Human Services Commission, the Education Services Centers, Project Aware, and then the Mental Health Transfer Center, but I'm missing the other T. Technology and Transfer Center. Sorry about that. All right, so hopefully you know about these resources. If not, definitely write them down or take a picture of the slides so you can go back. The Texas Suicide Prevention Collaborative puts out the, it's Ask Plus now, the gatekeeper training. Has anybody taken that or ever heard of that? Okay, awesome. If you are interested in this particular course, you can go to the Texas Suicide Prevention Collaborative and they will have this online course available to you. If you don't like doing online courses, there are several trainers or a lot of trainers that can give this face-to-face. So you can contact your local mental health authority. They may have a trainer, or you can also contact your education service center, who may also have trainings face-to-face. Okay, but this is an online and it is free because we all like free resources, right? Another thing, this is a grant-based, well, this program was initiated through, we used it through Project Aware, okay? And so we used the good behavior game. It's an evidence-based, trauma-informed approach to teaching kids self-regulation, how to be responsible. It's to improve educational outcomes. There's actually data and research too that shows that it reduces substance use. So through this PACS Good Behavior game, again, we initiated it through the Project Aware. Region 13 here out of Austin has a grant that provides free training for this. Now, the PACS Good Behavior game is generally used by teachers or those like in the school setting. However, they have branched out. So if you go to the texasgoodbehaviorgame.org, you can find different training. So there are, they call it PACS Tools. So PACS Tools can be used for community educators. There's one for health service workers, and they have recently opened one, I think it's for youth workers. So I do recommend that you go to the texasgoodbehaviorgame.org to check that out because these trainings are amazing and they're free.
And they send you a great big
Yes.
box of goodies.
Yes, they do. It is so exciting. And this has been, just from personal experience as a community project manager on the ground with the districts and the grant, we have seen a lot of good things come from it as the teachers are going through and using it in the school system. So I'm really excited that they branched out to the community. So I do highly recommend taking advantage that free training. All right, so we've talked a lot about the local mental health authorities and the education service centers, but again, through the non-physician mental health first aid, they really formed that formal partnership there. And then also through House Bill 19, we have the interagency agreement between the ESCs and local mental health authorities. They provide training for mental health first aid and trauma-informed practices. And then there's an annual report that is submitted to the governor. There is also just kind of information. It's Unified Services for All Children. It's USAC. And it's a group it's an interagency work group that convene together and talk about mental health issues within the state. All right, so every county is covered by a local mental health authority. And I know that some local mental health authorities have maybe a larger geographic range. Some have higher populations. You know, there's different challenges there. But everyone does have access to a local mental health authority. So and those are really important to bring together with different organizations because they provide a lot of great resources. This is actually put out through TEA. This is called Project Restore. It's a grief and trauma-informed practice learning series. It was done in 2020 during COVID, but it is a free trauma-informed practice training. So I wanted to mention that to you if you would like to take that for free. Here recently, through the TIE MAH and let's see, UT Austin, okay, the Texas Institute for Excellence in Mental Health, they have put out a training for educator wellness and trauma-informed classrooms. This is something that Education Service Center personnel were trained in, and then they will then train out. But I just wanted to make mention that there are that out there. Okay, so I told you about TChat. Is anybody familiar with TChat? All right. So TChat is the Texas Child Health Access through Telemedicine. And through this is funded through the legislature. And through this, every school district and charter school in the state of Texas has access to these services. What these are is telehealth that is no cost to the students or districts or anything like that. So districts have the option to form a partnership with TChat, and then what happens is students can be referred to them, and there's a kind of just a plethora of different services that TChat offers. Okay, they do provide free telehealth counseling and different services to that. So if you're interested, this does go through the school system, but for those even in outside agencies, you may have students, that are enrolled in a particular school district. So this is a really great way to be able to provide telehealth to those districts who can't afford any other avenue, and also to those small and rural school districts who maybe an hour to their local mental health authority or an hour to their next service. It is time limited, so it's not telehealth that can last for 2 years. It depends on each, they call them HRIs, it depends on each area as far as how long the services last. So I just wanted to bring that out there so that everybody has that knowledge there. All right, so this is just a slide showing that TChat services started in, was it June of 22? And so this is just the progression. So more and more schools are signing on to that. All right, there is also a fentanyl response communications toolkit that you can find on the TEA website. And this is a great toolkit. I don't know if you've heard of One Pill Kills. There is a flyer on there that you can download and share to give families, community members, whoever, more information about the dangers of fentanyl. Okay. All right, so we are winding down, And I just wanted to make a reference to this particular website. This is the Safe and Supportive Schools Division website. And through here, you will find the Fentanyl Response Communications Toolkit, but also you can find a lot of different information there. Restorative discipline practices. Dr. Gay Lang from TEA, she puts out short YouTube videos that kind of walk you through the restorative practices process. And I highly recommend that you go and check those out because those are really good videos that she puts out. So wanted to mention that. This is where you find the fentanyl and then also other school safety resources. So kind of in summary, I do want to give a few minutes for questions, but in summary, as we're looking at student health and wellness and their productivity and their success in the education system, again, schools don't have the resources to meet every need of every child. So that's why the interagency collaboration is so important, because we want to make sure that those partnerships are available so that students have access to what they need, that all students have access to what they need to make sure that their needs are met. Okay, so with that, I wanted to leave a little bit of time. I know we only have like 5 minutes, but is there any questions that maybe I can answer? Especially as it relates to the resources and things of that nature.
Thank you. We have one question from the virtual audience. There is someone that is asking if T-Chat is it available in charter schools or only public schools?
Is T-Chat available in charter schools?
Yes. Oh. Yes.
Yes, it is.
Yes. And there is, for that question, oops, wow, I messed it up. If there is the website for T-Chat, and on there, it will actually list the schools that have signed up for T-Chat. So you can know, like, for example, let's say you're a parent on the call today and you want to know if your particular school district has T-Chat, you can go to their website and put in their school, and it will let you know if they have T-Chat services or access. So I apologize. I'm going to get to any other questions? Yes, there's a T-Chat there. And here it is. It's the this email address right there. Website address, sorry. Okay.
Big thank you for our speaker this morning.
Thank you all for coming.
Thank you so much, Tammy.